Welcome everyone. It's great to have a number of you join us this afternoon. Let me start by acknowledging the traditional custodians of the land on which we meet and pay my respects to their elders past, present and emerging. For those of you I haven't met, I'm Michelle Higelin. I'm the Executive Director at ActionAid Australia and thrilled to have you with us this afternoon for this event focused on women on the front lines of the COVID-19 refugee crisis. At ActionAid, we felt that this was an opportune moment as Australia starts to flatten the curve and see the way out of the crisis, for us to turn our focus to how COVID-19 is impacting the communities we work with overseas. And so we're delighted to have Farah and Caroline to join us for this event today. Thank you both for being with us. We'll give you a proper introduction in a moment. I think as we said at the start, if you'd like to keep your cameras on, please do. Our goal with this event was to create a level of sort of, closeness and intimacy, but, feel free to turn it off if you choose. Obviously, if we have challenges around, hearing from our speakers, we will turn off video and obviously if people can stay muted when people are speaking. But before we get started, I did want to share that ActionAid has mounted a global response to this pandemic, taking what I would describe as a twin track approach to COVID-19. In the immediate, we've pivoted our work with communities affected by poverty and injustice in more than 45 countries to focus on urgent efforts to prevent the spread of coronavirus. We know that a prevention is essential in countries with weak health systems, and a number of the countries we work in have little or no ICU beds, very little oxygen supplies and respirators, not to mention an extremely stretched health workforce in normal times, which makes a rapid scale up of prevention efforts essential. And through these efforts, ActionAid is supporting the leadership of local women. We know that women are among the most vulnerable in this crisis, as the majority of our frontline health workers, the most vulnerable workers in our economies, as we're also taking the role of primary carers of sick family members. However, we also believe that equipped with information, resources and equipment, that women can lead prevention efforts in their families and communities. And through this process, there's an opportunity to fundamentally transform the way societies value women's leadership. And today you'll have a chance to hear about some of these efforts. And the second track, beyond the immediate prevention and response, is focused on campaigning globally to address the structural drivers of this pandemic. ActionAid has just released a global report which highlights that most low-income countries are ill-equipped to fight this pandemic, as they invest more in foreign debt repayments than they do in healthcare and education. And just to share an example, Ghana spends 59% of its GDP on foreign debt repayments, which is 3 times what it spends on healthcare. And we see that if these funds could be freed up, it would not only enable them to double their healthcare workforce, but still have 1 billion left to support social protection for some of the most vulnerable communities. So ActionAid is campaigning globally and in Australia to call for urgent measures focused on debt relief and investment in public services. And not just debt suspension, which is what we've seen coming through the G20. So we've also just taken up a role on the International Monetary Fund's Global Advisory Group as a way that we can try and have some direct influence on this issue. However, for today, we wanted to shine a spotlight on one of the most vulnerable population groups in this crisis, refugees, drawing on the experience of 2 women leaders in ActionAid who are working in very different contexts to support the response to COVID-19. So without further ado, I'm delighted to hand over to ActionAid's ambassador and journalist, Tracey to introduce our guest speakers and lead us through the discussion this afternoon. And thank you everyone for joining us.
Thank you, Michelle, for setting up the context so beautifully. I've been proud to be an ambassador for ActionAid for almost a decade now. I had the great privilege of travelling to Uganda in 2012 to see some of the incredible grassroots work ActionAid was doing with women and girls there. It really was transformative. And I too have been a little bit frustrated by seeing the coverage of COVID-19 in Australia be very insular and very national rather than taking a global perspective, particularly in countries where they are much harder hit than we are here. And that's what we're here to talk about. For the next half hour, I'm going to ask our wonderful two guests a few questions, and then we'd love you to ask some questions as well, because they really are on the ground, seeing this, hearing this day by day. They're doing phenomenal life-saving work. So I'd like to introduce you to them. First of all, Farah Kabir. Farah has been working in the field of development and research for more than 2 decades, starting her career with the Bangladesh Institute of International and Strategic Studies. She has research experience and a host of publications, especially on women in politics. She's been the country director of ActionAid Bangladesh since June 2007, which is extraordinary. She's also chair of the Global Network of Civil Society Organisations for Disaster Reduction. In 2012, she won the Nawab Ali Chowdhury National Award for her significant contribution in women's empowerment in Bangladesh, and we are so thrilled to have her with us. Our other guest is Caroline McCausland. Now, Caroline's worked in international development for close to 2 decades at a variety of organisations. For the past 4 years, she's been ActionAid's regional director for the Middle East and North Africa. Prior to that, she was country director at ActionAid Cambodia for 6.5 years. Can I start by asking both of you, and I think I'll start with you, Farah, about what kind of work you were doing prior to COVID-19?
You know, in 2017, there was this influx of Rohingya refugees who were escaping from persecution. And in just 3 months, we had almost 800,000 of them cross over to Bangladesh. And so we went in because of our humanitarian and emergency experience, wanting to stand by the refugees. So it was very much providing them with the initial food support, wash and other support. But whenever ActionAid engages with any community, we're looking at how are the women and girls being supported? What is the opportunity? Are they included? So it was very much along with the food and wash, looking at psychosocial care and trying to support anyone who's surviving from gender-based violence. And also we took up a strong role in doing advocacy for the rights of the refugees, because the government of Bangladesh was very generous, and we have to appreciate that for 2.5 years, they've had almost 1 million refugees. But the sensitivities around it, the need should be prioritized. Those are the areas where we have been working, and we created women-friendly spaces so that slowly the women could come and share. They were very traumatized. They had been deprived for decades. So this was, in a way, though they're living in a highly dense situation where it's like 70,000 per square kilometer, but they can breathe and they can get up and they can, pray, they can move around within the camp, of course. But this was a major change for them. And ActionAid has been supporting, bringing in our feminist values.
That's wonderful. I love the work that you're doing. Caroline, you also work in one of the most difficult parts of the world, particularly at this time in history. Take us through a bit of your work prior to the outbreak of COVID-19.
Okay, just to give you a little bit of context. I'm based in Jordan, in Amman, and in Jordan we're hosting 1.4 million Syrian refugees, which basically make up about 10% of the population. Of that 1.4 million, 53% are women who traveled from Syria unaccompanied, the vast majority. So we have been running safe spaces for women, so centres where women can drop in, and we've been working with women-led organisations to facilitate counselling sessions and group sessions with the women. We've made a very conscious effort of bringing host community women, so very vulnerable Jordanian women, together with Syrian refugee women. And one of the reasons for that is because this conflict has been going on now for 9 years, and the tensions between the two have heightened as the crisis has continued. So it's been very important for us to try and reduce some of those community tensions, and through working with the women and providing protection services, and helping Jordanian women also support the Syrian women, we've been able to reduce some of those tensions and address many of the vulnerabilities that these women are facing.
That's terrific and really speaks to women's leadership and women helping other women. Farah, I'm curious about the moment when you first heard about COVID-19 and how things changed dramatically in your approach at that point in time.
Tracey, it's the situation on the ground. We're already very stressed and stretched because providing water and food in that environment, and Bangladesh is a developing country, and even the small host community, because now the host community has become a minority in ratio to the Rohingya refugees, who are 1.1 million. So it was challenging that how we raise awareness and how are we going to ensure that if there is a case, that we can identify and take the measures, and the community spread. The fear is the community spread, because there's no way we'll be able to address it. And our health infrastructure is anyway very weak. It was already not very well developed. One level of development happened when the Rohingya refugees came, and suddenly we had to provide services for the government and UN agencies, and all of us together, we tried to put some, develop that. With the COVID, on one level, it was about the community spread. On another level, it's about our colleagues who are working the front line. How do we protect them? Because they are also dedicated and committed. And we have a lot of young women who, we call them volunteers, from the Rohingya community, but also from our, host communities, who are going in every day. At the women-friendly spaces, it's about the trauma, the counseling. Then they wanted to develop their skills. They're doing livelihood projects. We brought in women farmers from the host community to help them, and how they could start doing a little bit of homestead gardening and so on. So there's been a lot of engagement there. And how do we protect them? It's not fair, because we are all under lockdown. I'm staying in my house, and here I am asking someone. So it was pretty traumatic for me as well, what to do. So immediately we went and looked for the protection kit. This is not available. It's not available in the most developed country. So you can imagine how difficult it is. But we have sought local support. We are trying to provide them, do the social distancing, and also ensure that they travel in a vehicle with those guidelines. So when we went in, initial reaction of the host community and the refugee community was, don't come, because you guys are going to be the carrier of the COVID-19, because we don't have it. For 2.5 years we have lived here, we didn't have it. So how do we know you are not one? So we had to do a bit of trust building there. Because the initial reaction is, yeah, we are in a difficult situation, but I'm not sure we want you guys to come from outside. And this is where we all sat down and we had to do trust building. And women have been such an asset in this. Both are refugee women as well as the volunteers, to build that trust.
You raised some really important points there and some huge challenges, Farah. I'm just going to jump to Caroline to get her assessment on it in her area. Caroline, do you remember the moment when you heard about COVID-19 and what went through your head? What were the first initiatives that you put into place?
Well, the first thing that went through our heads was, what is going to happen to the refugees and the migrant workers? The majority, 80% of refugees in Jordan actually don't live in refugee camps. The refugee camps, we have Zaatari camp, which is what we describe as the fourth largest city in Jordan. It's actually the second largest refugee camp in the world. And it has a population of 74,000. And the tents are literally just one after the other. And so the first thing that went through our minds was there is the measures of wash your hands, physical distancing. This is just not a reality. When we also thought about the other 80% that are outside, these are people who are living day to day. They try and get bits of work that they can. They have rent to pay, and many are seasonal workers, or were running, very, very small businesses which provided for themselves and their families. These stopped overnight. Jordan went straight into martial law because we knew we wouldn't, or the government recognized it was not going to be able to possible if there was a large outbreak across Jordan to maintain it. So yes, I mean, our fear was how do we support these people through this period of time? And from ActionAid's side, we did a lot of lobbying because the life-saving support for the refugees stopped because we were all put under curfew. So nobody was able to provide any support for almost 7 days into the camps. So that got moving. After 7 days, there was enough lobbying at high levels that was reinstated. It's been very, very difficult, but it is happening. So cash support is still continuing. In the community level with the women that we work with, we suddenly said, well, these women are traumatized already. We need to reach out to them. How do we do this? So through phone, initially we reached out, and then we managed to orientate them in how to use Zoom. We managed to get internet credit to them so that we could continue the women's circles, and we could generate some kind of support and listen to their concerns, and also address a lot of the rumors that were circulating around. So we've done a lot online to maintain that content and to sort of reassure the women and try and provide what support we can in very, very difficult times.
Isn't that brilliant? That's such a great initiative to keep them connected and informed. Farah, what's the state with testing where you are? Is there small scale, large scale testing, no access to tests whatsoever?
In the country itself, testing is pretty inadequate, and it has taken us a long time to even build up. And right now, if I give you a statistics, there's 24 proper labs for the testing, and 6 in the government, in the public sector, and 16 more are being set up by, and we are a population of 170 million, leaving the refugees out. And so the government and the Prime Minister is really working on taking this, the measures taken by some countries where they do mass testing. So it is centralized, but we're lobbying on testing around the refugee areas and inside the refugee, but it's still waiting to happen, because you need the testing kits. And one of our freedom fighters, he's a doctor, he has produced a very low-cost testing kit. But even in COVID, the politics has not gone away. There's this government officials and bureaucracy, and then so if his test kits are taken, then it will be easier to conduct. So answering your question, it is very, very low at the moment, and it's even lower for the refugees. It has not started. On top of that, the misinformation and the fear, because there have been cases of where children have abandoned the mother, left them, or a husband has left the wife outside, or people don't even if they have a cold and a cough, they're a bit scared to share or to go to the doctor. And our health sector was not prepared, and it's anyway inadequate. We've got like 1 doctor for 20,000 people. So you can imagine. So on top of that, there's this fear that if I have a cold or a cough, then I might get into the isolation and be abandoned, and women face a higher risk of being abandoned.
Absolutely. And there's another gendered aspect to it that we're seeing here in Australia, an increase in domestic and family violence because of people being trapped in their homes in unsafe situations. Caroline, are you seeing that in refugee camps on an exponential rate, the increase of violence against women and girls?
We're seeing it in the local communities and in the camps. The problem we're facing is there are no services currently being provided. Besides, so there is no way for protecting these women and getting them out of their current situations because of the curfews. And so it is something that we've been raising with the government, and there is a recognition, but it's an incredibly difficult thing to address at this current time. And we're looking at how we can improve this. We are giving hotline numbers, places to call, but again, they can't take them out of their situation. And that's the struggle we're facing at the moment.
Farah, have you seen an increase in that in Bangladesh as well?
Yes, and both in the majority community as well in the refugee community. And we're conducting research. Other organizations are also doing. And because of the loss of livelihood and economic activity, a lot of the men are now engaging in a greater level of domestic violence. But there is also the double burden. Now that the women are, first of all, we have a huge garment sector workers who are mainly women, and they have lost. So when they've gone, they have to go back to where, their area of origin. They don't have money to pay rent or stay near the factories, so they have to go back to the villages. So there's no food, and the men are kind of abusing them because they're saying, put the food on the table. I mean, get the food from somehow. Or the other. Secondly, they have to take care now of the children and the elderly and the sick. And so the care burden has gone up, and they're all confined. They cannot take any other support from anyone. Like Caroline was mentioning, there are hotlines for domestic violence, but it can only be a teleconference. No one can take the woman or the girl out of the space. And the law enforcing agencies have been pulled into managing the lockdown and quarantine, because in this country where it's so densely populated, in a way this isolation, social distancing makes no sense, because I don't have the space. We live in even in the slums or even in the low-cost housing, there's one family of 6 or 7 living in one room or maximum 2 rooms. So where will they go? They're staying inside, but the distancing is very difficult. So the law enforcing agency is much more engaged in ensuring that people don't come out, they stay in their homes, or they manage the social distancing. It's not a curfew, but there are, like, from 6 in the evening to 6 in the morning, you're not allowed in certain hotspots to even come out at all, even in the front of your building. So we're not getting them to help with the domestic violence support.
It's a multifaceted problem.
But telecounseling and conference is happening. We have also set up psychosocial support for our own colleagues and also for the.
That's terrific, Farah. I love hearing about some of the initiatives, and I want to talk to you about that as well, Caroline, because while we do see that women and girls suffer more in the aftermath of disasters, whether natural or otherwise, women and girls also have great leadership opportunities. What are some of the positives that might come out of this and that ActionAid's working on at the moment?
I mean, when there's a crisis, there's always an opportunity, as we say, and we're already seeing the women stepping up. I just had one of my colleagues reporting to me yesterday from Lebanon, where we actually had one of our women's circle. She's Palestinian, but she's Syrian. So she's a Palestinian from Syria, and they are one of the most excluded groups because they don't really classify as a Syrian refugee, but they're also don't classify as Palestinian. So they were reporting to me yesterday a very sad case where she was tested positive for COVID. And then when she went back to her, into the camp didn't want to take her back. But because of the support network around her, there was a lot of negotiations, and eventually they found a space for her to be isolated, and that she would be then taken care of by many of the women who were part of our women's circles. So again, it was that stepping up and the support. I think moving forward, where we are likely to see the women really take leadership, is helping us identify those who are now falling through the gaps, because we're going to see those who were surviving before who are going to be very desperate because of loss of income, etc., etc. And so what we're hoping, and that we're already talking about it, is how do we identify these women, and how do we get support to them once we're able to move.
Farah, what kind of similar leadership roles are you seeing women taking in Bangladesh since COVID-19 struck?
They are coming out in the areas of identifying and then trying to support them through this. Not everybody is like, there was a lack of understanding that COVID-19 does not immediately lead to death. There are levels of severity, and you can be, if you have the immunity, or you can have the right kind of care, you may be able to also overcome. So this is where we are finding engaging the women leaders from our circle, similar to what Caroline was saying we have in that space, and then the women volunteers. But we also need a little bit of time to train them, to understand and help. What is challenging is, where will you isolate them? In the camp area, where as I was saying to you, that there's 800,000 refugees, and in a very, very small area. Do you know how big Bhutan is? It's even smaller than Bhutan, where has a population of 1 million. So can you imagine? It's very difficult to imagine, 70,000 per square kilometer. So we are talking about, yesterday we had a meeting with the different UN agencies to be able to identify isolation spaces and put them. And the army has come down, and the army has also, but I think the army is also now trying to collaborate with us and the UN agencies, so that it's not going to be possible to manage this alone. So there is also another area where that women leadership is possible, to establish the information flow, so there's no misinformation. If we give the women simple information and correct information, they will take it to the women and the family, then help them in terms of isolation and taking care, also the elderly, and work with them on the prevention, basic healthcare. Like, there's a suggestion that if you drink hot water, if you take a lot of C vitamin, your nutrition level is high, you can fight it at the initial stage. So we are hoping these are the areas where we will work. And our, of course, focus will be on trying to keep the domestic violence out, if not at least to reduce it, do counseling. So we've also set up men centers, because the men are going through the stress, and we're trying to support them. And that has been appreciated by all actors, stakeholders in the camps.
It's so complex, isn't it? Because it's not just physical, it's not only health, it's
very, very, very.
It's also economic, and the expectations are that with this Great Depression or Great Recession, whatever we'll see in the next couple of years, will come even greater exacerbated inequality globally. There's a lot of really good brains on this Zoom discussion at the moment with our fantastic supporters. What would both of you say that everyone can do to try to work towards pushing back against this extension of inequality around the world?
There is an immediate need of the health and support and identification and tests and dealing with the information. But there is also the midterm and long term. And I think we need to work with the government in terms of providing that support. And we are doing advocacy, so the government's providing the support to the smallholder farmers. It's coming up with packages for the daily informal workers. Our concern was all the women and the informal workers, because immediately with the lockdown, whether it's the tea shop or it's the small grocery shop or the construction worker and the ready-made garment workers. And we in Bangladesh have migrant workers who have been all sent back from Italy and Middle East, and we don't know when the economy is going to start going back into operation, and the demand will be there and we can work with that. So that is an area where we need a lot of support from your governments, and on an individual level we need support to help set up for the COVID the test kits, the PPEs for the frontline workers, for our volunteers, and also for the care providers. We are looking and talking about doing some development of paramedics and support, at least for the information and so on. So if there is support in that area in terms of working with WHO and others, or it is a time of solidarity also, because every country is affected. It's not about just any one country or any one region. So as you said, it's in a differentiated manner, because they were already vulnerable. So it's, again, not that sort of an equalizer. The good thing out of this has been the environment, but we've already damaged the climate in such a way that we can't hope that it's going to turn around. So we still have to continue our fight on the climate change and system change, because we have to be careful that once everything goes back, it does not go back to where we were, but goes back to a better world.
Yes, we don't want to go backwards. Caroline, before I open it up for questions, and we'd love to hear from all of you who've joined in to listen today. Please feel free to ask these magnificent women anything. Caroline, if we can learn one thing from this crisis, what would it be?
I would say that it's exposed phenomenally the inequalities in the world, and just how many people were just purely surviving. And our economic model of the corporations influencing our policies, which was, and tax evasion, and how far it's left public services underfunded. And the lack of social protection mechanisms, which has come with corruption and many other things that we're seeing in the countries in this region. What that has done, what it means is that in the response to this crisis, the money is going to go to support our own the nationalism, and we're going to forget that there are millions who are going to become desperate as a result of this crisis and this inequality. So the support really needs to go to the refugees and migrants, and keeping it on everybody's agenda. That we are actually, as individuals, very fortunate when we come from countries where they're stepping up. In Australia, you've got a decent health service. No health service is perfect, let's be honest, and we all whinge and moan, but you have something, and many of the people we're working with have access to absolutely nothing.
Well, thank you so much, Caroline and Farah, for the life-saving, life-changing work that you do, and also putting your own lives at risk by doing this. It is absolutely phenomenal. Let's open it for questions now. Now, you can either ask a question through the chat functionality by tapping on chat and then typing your question, or you can simply hit on the put up your hand little logo, and Simon or I will see it and we'll go to you. We've got a comment from Joe from the Norman Family Office. What a devastating situation. Thank you for sharing. So thank you so much. Any questions, please shoot them through. While we're waiting for another question, Farah, I'll go back to you. what can each and every one of us do in our own families? I know often we talk about these things as big picture issues, and they certainly are. They're very thorny, difficult topics, but I've got 2 children, aged 13 and 15. What can we say to our kids to make them more aware of this and more active to be able to help change things?
I think, as I was saying, that it is about recognizing the climate impact, what we have done. And for the young people, our generation and a previous our generation, the generation before, we've mistreated the world and the environment. So the young people can lead on that, and they can adapt to a much more environment-friendly style of life. But more importantly, it is about recognizing the diversity and the inequalities that exist in society. Why we're fighting for the rights of the refugees. People are treating them in any way they like. I mean, the refugees, I actually am very proud as a Bangladeshi that we have been working with the Rohingya refugees and treating them in a much better way than what I see happening around the world, but there's still refugees. And my point is, where were we for the last 40 years when Burma and Myanmar were abusing them? So we have to be very careful that we don't let any injustices pass by and ignore them. It can hit us at any moment. So we have to take up our position on the rights and justice issue.
It's a great.
We recognize that it does have a gender dimension.
Oh, sorry to interrupt, Farah. A question came through for you, and it's really related to exactly what you're saying now. It's from Gemma, and she asks, Farah, what kind of things are you hearing from your staff/volunteers on the ground in Cox's Bazar? What are the women telling you?
So the women are telling us that they feel that they're more vulnerable. I mean, they're worried about their family, they're worried about the children, and the messaging is like making them hide instead of come forward and say, okay, I want the testing. And so we need to work on that. And prioritization is now on the gender-based services is going down. They want to go back to work. They feel extremely trapped. And if you've seen the photos, you might be able to imagine that it's plastic shades and bamboo frame, and they're one on top of the other. And in one little space, there's 6, 7 of them, young children. So it's very difficult even to breathe in there. And then if you have to stay within, they want to come out. So quick and immediate testing and identification and support. And this is also the monsoon season when you have cyclone. So they have that worry. Where will we be shifted if there is a cyclone? So we need reassurance and that sort of a structure, infrastructure, where we can move them. But as I was coming back to your question, because I really like that question about what do we tell our children? We tell our children about the inequalities that exist and how gender discriminated it is. It is also about the diversity, not recognizing the different communities, even the transgender and people with different sexual orientation. The sex workers, outside the refugee camps, we're working with a lot of other communities and we are having to support them because nobody else is coming forward.
That is terrific advice.
We need differentiators.
I'm just going to move on to another question because it's about a very practical consideration. I'll go to you on this one, Caroline. And the question is, there's an opportunity from suppliers of PPE to have it available for ActionAid volunteers in those camps. Clearly, the exorbitant costs being demanded will make them unavailable. Is there a place for governments to assist, or what other ideas might help?
There is opportunities for the government to assist. What Jordan has done is there is no testing in camps, and there are no, as I mentioned earlier, no facilities to respond to any cases of COVID. What the government has done is set up isolation places outside of the camps. And I think that Jordan is being very, very restrictive. So they are not going to allow this to happen inside of camps when they don't have the equipment for their own populations. And this is one of the things we need to be very conscious of, is that if we start providing supports to the refugees, that creates more tensions and more resistance to refugees in the host countries. So we need to make sure the balance that the services being provided are open to both. But Jordan would be very, very open to receiving any support it can get.
Terrific. There's another suggestion here as part of the question on ventilators. Joseph has written, Australia now has 7,500 ventilators and is building more. Thank goodness at present we're using fewer than 100 of them. Clearly we're not out of the problem in Australia yet, but can ActionAid lobby for some of these to be sent as aid to refugee camps, acknowledging it needs expert operators for these machines, so with partners such as Médecins Sans Frontières, for example. Maybe I should go to Michelle on that one, actually.
Yeah, that's fine, Tracey. I was actually just starting a response to Joe. Yeah, I mean, I have to say one of our first immediate sort of advocacy points was with DFAT to increase support to, refugee settings, both to address the immediate protection needs, but also some of the urgently needed equipment. So we have been lobbying DFAT around sort of that systematic support, with other development organisations. I think what you're proposing is very practical. And particularly as we start to improve the situation in Australia, I think definitely that has to be some of the, the call around how do we now get this surplus of, life-saving equipment as well as protective equipment to the countries that most need it. So yeah, we appreciate that suggestion. I think it's a very practical one of something that we can do.
It's a very good idea. Thank you, Michelle. We'll wrap up the question time now. I'd like to ask for some final remarks from both Farah and Caroline. Farah?
This is an opportunity to at least address some of the inequalities and also to try and recognize where we need public services, the infrastructure. So governments of Australia and Bangladesh have agreements and so on. So this is an opportunity to build on that. It's a third country, but they need to go on. They cannot be living in a refugee.
Farah, I think we're losing your connection.
And
what I might do, Farah, is go to Caroline, and hopefully your connection will be stronger by the time Caroline finishes, and we can get you to finish your remarks without it being interrupted by the weird robot sound. Caroline.
Thank you, Tracey. So from my side, I think we need to keep refugees on everybody's minds, because they are going to become, they were already struggling to secure resources for basic needs now. Prior to this COVID-19, we are really going to see significant drop. How should I say this? There will be people are not going to prioritize refugees or migrant workers. And I think it's imperative that all of us keep raising the issues of the most vulnerable segments of our society, which are women, from fleeing from conflict, or who have had to move for work, so they're migrant workers. These populations are incredibly vulnerable, and I think the more we talk about it with our children, in our families, with our friends, it keeps it on the agenda, because we are going to need a massive input of money to be able to support these groups of people around the world, not just in this region. We have the same issues in Africa as well.
Thank you, Caroline. Farah, I think your line might be a bit clearer now. Would you like to say some final remarks?
I think I can't start the video because my internet connection is not too good, but I see in the chat box Peter Sainsbury's points, and absolutely he's articulated my thoughts so well, and I echo what Caroline has said, that this is, you know, we have to remember that they are in double jeopardy. The COVID-19, if we only focus on that, then we have to build their nutrition, we have to help them to develop the immunity. That is where we need to focus, because one is the identification, whether they have it or not. If they don't have it now, they can have it in the next round when it comes. So we need to be able to build those packages with that sort of understanding. It's not enough just to give them the basic refugees. Health infrastructure for the host community and them, so that, you know, we don't end up creating another round of conflict. If you only focus on the refugees, as has already been said, we will have tension among the host community. So we need to have a very well thought out plan and package.
I think we're losing you again, unfortunately, Farah, but your point is well made about double jeopardy and also the political danger of not wanting to increase the pushback against refugees. You mentioned Peter Sainsbury's comments, and for those who aren't looking at the chat box, I'd like to read them out because they encapsulate, I suppose, a big picture issue that we've been talking about here. Peter writes, Farah's point is so important. It is, of course, so important to do all we can to assist refugees, but the deeper issue is, why are there refugees? Putting aside truly natural disaster, we, the privileged West, ignore the exploitation, violence and discrimination that create refugees in the first place. In fact, we don't just ignore it, we allow organisations based in the West to be complicit in creating refugees. We build and sell arms to very dodgy governments. Our multinationals exploit mineral and agricultural resources, etc., etc. So thank you all for engaging in that incredible discussion. I'd like to thank you both, Farah and Caroline, from the bottom of my heart for articulating the issues so magnificently, and anything that we can all do in Australia to help, we absolutely will. ActionAid is raising money at the moment. I can tell you from having been in Uganda with the team at ActionAid that the work is absolutely astonishing, and what I love about it is it's led by women and girls on the ground. It's incredibly empowering and truly feminist work, because we know that women and girls are the glue that hold communities together, and by goodness, we need that at this time in history. If you want any more information about what money's being raised at the moment and what ActionAid's going to do with it, please ask Michelle or Simon for the details, or hop onto the website. But it's been an absolute privilege for me to speak to you both, Farah and Caroline, and Michelle, to hear more about what ActionAid's doing at the moment. So thanks for having me.
Thanks very much, Tracey. Before everyone goes, I just want to, firstly, thank you, Tracey, for moderating the conversation. It's lovely to have your support of this initiative. And Caroline and Farah, thank you so much for taking time to be with us in what is your morning, our afternoon. I think, as you've highlighted, I mean, this crisis is exposing the huge global inequalities. And I think you've really brought that home very clearly. And I think there's been a lot of discussion in Australia about how vulnerable migrant workers are, and and refugee populations, and we definitely know we need to be doing more in this context to be lifting the voices and trying to advocate so that there are strong solutions that are inclusive of those who are most vulnerable. So thank you both, and please be assured that we will be working in solidarity with you and looking at ways that we can support those really important efforts in the community. I also just really want to thank everyone who has taken time to join us this afternoon. We appreciate it. And you can continue to stay up to date on the work that we're doing throughout the ActionAid Federation, including in both Jordan, Lebanon and in Bangladesh via our website, which is actionaid.org.au. And I think, as Farah also highlighted, the importance that we also don't lose sight of issues like climate change, which obviously, bringing in any kind of climate crisis in the context of COVID-19 alongside, existing high levels of poverty and inequality could be quite catastrophic. I mean, we're already seeing this starting to emerge in the Pacific, even following the recent cyclone. Obviously in Africa, that's also very live. So we are hosting another conversation next week, which we can share some information about. This is being done in partnership with Women's Agenda, which is looking at how we can take the opportunity of COVID-19 to continue to drive urgent climate action. And we're delighted that we'll also have the country director of ActionAid USA joining us for that, Niranjali Amarasinghe. So if you're also interested, please do join us for that. But a big thank you everyone for joining us. And we hope you have a good afternoon and continue to stay safe. Thanks everyone.